Your doctor suggested you have a look at this presentation on chronic ankle sprain and maybe follow some exercises I'm going to give you at the end. So before we go to that, let's just have a look at the ankle from the point of view of the injury you're talking about. Start off by looking at the anatomy of the ankle, and in this diagram you can see the ankle consists of the bones, but there's a lot of grey material or ligaments around the ankle that constrain it and stop it going over, particularly turning out or turning in, and allow it to be used in walking and standing and things like that. But sometimes they don't work and you turn over on your ankle, and when you do, it's sore and you hurt it obviously, and that sprain can damage some other mechanisms that help your balance, and so as a consequence of that your balance may not be as good, and as a consequence of that you may re-injure your ankle, frequently in minor ways, and then maybe there'll be fewer major events, but that you are an ankle sprainer. That occurs because of the original injury has probably reduced your ability to know where your ankle is in space, and so your balance through the ankle and the coordination of your muscles to keep your ankle steady is not as good as it used to be before the first injury. You need to re-educate your ankle. Most people with chronic ankle sprain will experience ankle pain, usually on the outside of the ankle, usually worse at the end of the day, particularly the day they're on their feet. It will usually be worse if you walk on rough ground. And many patients complain of feeling it's not secure, it's unsafe, it could go again very easily, and they're careful on rough ground. That's often how people experience chronic ankle sprain. Now you can do a test on yourself to see if it's affecting the ankle that's sore but not the other one, and that's if you stand on the foot that's not sore and you just get a sense of how steady that is, and then compare it with the other foot when you stand on the foot that's sore or that gets sore or that gets sprained. You stand on that and you see how steady that is, and normally one would expect the bad leg to be less steady and more wobbly. In order to correct this, you need to take some time every day to teach your ankle about where it is in space and to try and reverse that wobbliness, so that when you do go to walk, when you do go on rough ground, your ankle is more secure and is less likely to re-injure itself. The exercise is very simple, and I show it to you here in this little demonstration. Stand on the relevant foot using the back of a chair as security, but try to stand unaided, and attempt this for 5 minutes daily over a 3-month period. Keep trying for the 5 minutes. You can continue to do those exercises for a long time after everything has settled down, so that you again reinforce the security of the ankle. If those exercises help, great, and I would expect them to help most people with typical chronic ankle sprain. But if they make you worse, or if you're not getting better in spite of adhering to the program, then you should go back to visit your doctor. There may be something else going on that needs attention, or you may need more elaborate treatment that I can't deliver through this medium.